I'd like to walk you through a cataract surgery here. That's a 3mm marker, marking an initial incision that will be a clear corneal incision. This is a topical case. You'll see here a diamond guarded blade, 300 microns, so that's 1/3 of a millimeter. And this is an initial incision into the temporal aspect of the cornea. Same blade using to make a paracentesis, which is 1mm in size. And now I'll be placing some intracameral lidocaine. This is just some numbing medication that will make sure the patient has no pain during the procedure. Now I'm going to form the front of the eye with a special jelly, which is called a viscoelastic. This is Helon. This protects the endothelium and keeps the front of the eye formed. Now I'll be using a diamond keratome. That's 2.8mm in size. I'll first engage the 300 micron incision that I made earlier. Make a tunnel into the cornea and then enter the cornea. This makes a 3-stepped clear corneal incision that will seal at the end of the case without any sutures. Just making sure it's a little bit larger because that particular diamond is 2.6mm and my injector is 2.8mm at the end of the case. Now I'm using a cystotome. It's a needle with a bent tip, and this will be used to make a continuous curvilinear capsulorhexis, essentially a hole in the front of the bag that holds the cataract. I decided to switch to a Utrata forceps, entering the anterior capsule. Then we'll be tearing it in a round circle. The round circle, just like an arch, has a lot of strength, and during the case when you're removing the parts of the cataract, it will maintain its integrity and not tear. It's about a 4.5 to 5mm capsulorhexis, which will overlap the edge of the artificial lens or implant at the end of the case by about 1 millimeter. Just tearing the anterior capsule around here for a nice round circle, which we'll see at the end. Now I'm going to use a chain cannula and dissect between the bag and the lens. You saw a wave of fluid trace around the lens. So now the lens has been freed from the bag and will rotate freely inside of the bag. This will allow us, with the phacoemulsification, which is like a small vacuum with a ultrasound that will break the lens material up. It also has fluid that will maintain the front of the eye during the cataract surgery. This is a Lieberman, which is a second instrument that allows you to break the lens into fragments. You'll see me splitting in half here. Now I'm going to rotate the lens, and I'm going to make another crack in the lens. What this does is allows me to bring a section of the lens forward and break it up with the phacoemulsification, which is the little ultrasound. The lens doesn't always want to come out. Sometimes it takes a little work. And here you'll see me grasp it again and pull it forward, break it slowly. Now this is a relatively soft lens. Some cataracts are much more dense and require you to take smaller segments. But the essential idea for all cataract surgery is to take the pieces out in a controlled manner to allow you to preserve the bag that holds the lens. So we've taken out the nucleus, or we're taking it out here, one little segment left, and around the edge you're seeing the cortex of the lens. It's like an onion. In the middle there's a more dense part, and on the outside there are thinner aspects of the lens. Now I'm gently removing the last few pieces. Now what you're seeing is the bag with just a little bit of the remaining cataract. And we're going to take a vacuum and gently peel those off the bag. The front of the lens capsule, the bag that holds the natural lens, is only about 20 thousandths of a millimeter thick. And the back is around 6 thousandths of a millimeter. And what that means is that during the procedure you have to be very careful not to grab it. Otherwise you could induce a tear. So I'm gently peeling off the last remaining parts of the cataract, one segment at a time, and what that leaves behind is the clear bag that will form and put a nice artificial lens in. Gently grabbing the leaflet of the remaining cataract portion, pulling it forward here. Now we'll move around and pull out the rest. What I'm doing here is just removing a few last pieces. Now we're going to take some of the jelly-like substance that was used at the beginning, called Helon. We're using it to form the bag. I'm gently kind of massaging off a little piece from the back of the bag, and now I'm forming the whole bag. And inside that bag, with this injector, I'll put an artificial lens. This particular lens is a Technis Z9003, which is a three-piece silicone lens. There are many different types of lenses, and you'll have to work with your eye surgeon to select the lens that will best serve you. The lens is well centered, and it's held in place by those blue little feet. They're called haptics. They open up to about 13 millimeters to keep the lens nicely centered. What I'm doing now is taking out remaining viscoelastic, which is that jelly that formed the eye, and now I'm going to use some balanced salt solution to hydrate the wound. That was the one that initially created, and this will allow the eye to be firmed up to good pressure. Testing the pressure here, letting a little bit out, and now I'm going to use a little sponge called a Wexel to test the wounds. And that's it.